Your eyes do not deceive you. We're back for another exclusive interview discussion with two very important figures in the early childhood world. Let me tell you, it's a first here today. We've got a massive crowd of fans behind the camera. Unfortunately, our equipment won't swivel that far back. It's huge. Let me ask you both, Dr. Lovett, Dr. Briggs, do you have adoring fans following you everywhere you go? Every day of this conference, or is this
only my grandchildren when they know that I've come back from a trip and they're expecting a gift.
Oh,
yeah, they are adoring fans when
smart.
I do that. Yes,
that's just smart.
Yeah.
Great. Well, first let me give some introductions here. We have Dr. Rahil Briggs directly to my left, National Director of Healthy Steps, and Dr. Pat Levitt, Vice President, Chief Scientific Officer, Director of the Sabin Research Institute at Children's Hospital in Los Angeles. Thank you both so much for being here today. Dr. Levitt, I want to start with you. This morning, you gave a very, very exciting scientific plenary address. For everyone, for all our viewers at home, can you give us a quick overview about the HERO research?
So the research I talked about today is unique in that the Center on the Developing Child at Harvard organized a consortium, a large group of scientists that participate with practicing pediatricians in the community. We're trying to understand how we can identify measures that would indicate red flags for infants and toddlers in particular who may be at risk for experiencing early adversity, something that we call a toxic stress response.
Yes.
And so one of the unique things about the project is starting at the very beginning, trying to use measures that we think are going to be scalable within pediatric communities, very important, and also to engage with pediatricians as well as community leaders so that we can have better information about the kinds of measures that pediatricians would embrace and want to use, and also engage community leaders about how to talk about these measures in a way so that we don't raise the red flag and then people thinking that what we've identified is an inevitability for poor outcome.
Thank you. Dr. Briggs, can you tell us what Healthy Steps is, the Healthy Steps program?
Sure, I'd love to. So Pat and I have worked together quite a lot because Healthy Steps actually is in the pediatric setting. And Healthy Steps is an evidence-based national program, a program of 0 to 3, where we add a new member to the pediatric primary care team. That person is a Healthy Steps specialist, and they're usually a specialist in child development, parent-child relationships, and they co-manage the care of children alongside the pediatrician. So those wonderful 12 first visits in the first 3 years of life. Now, in addition to seeing the pediatrician, you see your Healthy Steps specialist who's going to ensure universal screening for autism, social determinants of health, maternal depression, child development. Something else you spoke about this morning, the very low screening rates around this country, almost 30% nationally. In Healthy Steps, we require 90%. We're going to do short-term intervention for children with what we like to call the light pink flags of concern, just the earliest possible warning sign that something's not going perfectly well. And for our families most at risk, and we may learn more about that through some of this biomarkers work, really co-managing the care alongside the pediatrician to ensure that children emerge from those early years of life ready to learn, ready for school, ready for life.
Can I just want to add to that. The reason this is so important in terms of screening and then identifying the pink flags, I like that better than red flags, light pink, is that this time for infant brain and whole body development is a time where interventions can actually have its biggest impact. So identifying early is really, really critical. I can't overemphasize that. Early identification and then the programs that can really address some of those needs early on is going to have a much bigger impact and very cost effective compared to waiting much later on in life.
Great, and it's so great to both have you here. Dr. Levitt, I want to stick with you for a second. Who's involved with this research? Of course, you've spoken about the pediatric setting being important here, but who's involved with the research and why is it important? Can you speak to that again?
So in terms of the scientists who's involved, so we have 7 collaborative sites. Our site at Children's Hospital Los Angeles, Rockefeller University, Boston Children's Hospital, and Harvard, University of Minnesota, University of California, San Francisco, McGill University in Montreal, so we're international. And so there are 7 sites, and we each have different kinds of expertise, so we're trying to identify different measures, so it's a lot of teamwork in terms of doing complementary work so that we're not repeating each other, although the sites work together on trying to develop these kinds of strategies. And I think the other thing is, who else is involved in this research are families in our communities who, some of them most of them, for the first time are participating in research. And getting a lot of information, just basic information about child development. So even just participating in research has had a great impact on them in terms of feeling like they're belonging, which they do, having a big impact and on research that may help many, many others. And there's something empowering about that. So I think that's a really important part of what we're trying to do as well, is to empower the families and have them participate in this way.
And now you've both spoken to red flags and now pink flags, so a bit of a gradation there. Can you speak to what some of those are? What are you measuring? What are those red flags and pink flags?
This is you.
Well, it depends on if you mean what are we measuring through these biomarkers? Is that what you're asking?
Yes.
The biomarkers.
I defer to you.
Okay. So we're measuring basic development of the infant. We're measuring their brain activity. They wear a sensor cap to measure their EEG, and we can follow them over time. Very important. This is a prospective approach, meaning that we're recruiting moms like right after they give birth. That's an interesting recruitment challenge, by the way. And then starting at 2 months and going all the way to 36 months. We're measuring their attention. We can start at 2 months and measure their ability to attend to screens. That's all wireless. We're measuring their body physiology to determine whether they have something called oxidative stress, which puts increased demand on their cells, particularly their brain cells and other cells, to actually function properly as it's developing, keeping in mind that changes are occurring very rapidly. I think I mentioned this morning that there are about 1 million nerve connections a second that are being formed. 1 million a second.
Huge.
So think about that. Every time you see an infant and you blink, there's another 1 million connections. We're measuring caregiver-infant interactions, which is very important and extremely important in terms of buffering whatever light pink or dark pink or red flags might emerge. And we're measuring this over time so we can determine whether the infant is progressing in a typical way or whether there are some deviations, and I think that's also an important part of the study.
Great, thank you. And then Dr. Briggs, what does this all mean for pediatric primary care in your thoughts?
Sure, it's a great question, Mauricio. And pediatric primary care is this country's basic only system where you have universal access to infants, toddlers, and their families. Little secret, nobody comes to the pediatrician on their own for their 1-month visit. They're not coming on the school bus. They're coming with parents. If you're looking to reach parents, they're at the pediatric practice. And by pediatric, of course, we mean family medicine, anybody who's providing well child care for children. What we are sometimes challenged to do, though, I think anybody can find a 7-year-old with really intense ADHD. We know what that looks like. They usually tear up the exam room and they struggle to pay attention.
That was me.
How about a 7-day-old who's living in a family exposed to a lot of toxic stress and who would really benefit from our most intensive level of services in Healthy Steps? Before this work, we were relying on clinician judgment and parent report, and we'll still rely on those two very important things. But what we're able to add now is a game changer in terms of some actual data and information about the toll that toxic stress is taking on that 7-day-old.
Wow. And as you bring that up, Dr. Levitt, I'm wondering if you can share any early findings from the research so far.
So we've recently published a paper, the group from Boston Children's Hospital and ourselves at Children's Hospital Los Angeles. I think two principal findings. The first is that the change in brainwave activity, when you see deficits in that seems to correlate with maternal perceived stress. That is, in this case, mostly moms are filling out a form about how they're feeling about their lives at that time. Are they feeling stressful? So they answer some questions, and those who score high on that, meaning they have their perception is that they're enduring a lot of stress themselves, seems to be having a translational impact on the development of brainwave activity of the infant.
Wow.
The other thing that we found is that a buffer, which we may define as some aspect of resilience, is that maternal education, that is a high school diploma or higher, actually correlates with better development of brainwave activity in the infants. So that's a really interesting finding. Other research has sort of pointed to this, that one model might be to encourage and to facilitate primary caregivers from increasing their education by providing greater access to at least achieve high school diploma, and that seems to be a buffer that we can look at as something that would have a large impact on the family.
Incredible, incredible. Thank you so much again for both being with us here today. If our viewers at home are interested in learning more about the study and about Healthy Steps, where can they go to get that information?
So for the research study, the Pediatric Innovation Initiative, they can go to the Center on the Developing Child at Harvard University. If they Google Center on the Developing Child, Harvard University, there's a lot of material about what this Pediatric Innovation Consortium and effort is all about.
Great, thank you.
I believe that Harvard website might be developingchild.harvard.edu, having been there a few times. For Healthy Steps, we invite you to visit healthysteps.org. And want to let you know that the future of this work, we're about ready to think about the next phase of this work and really taking it to scale, and Healthy Steps is going to play a significant role in that scale. We currently have programs in 21 states, Washington, D.C., and Puerto Rico, serving over 150,000 young children and families per year. And we're really excited about bringing this biomarkers measurement into our work.
Great. Great. Well, thank you. Thank you so much, both Dr. Briggs, Dr. Levitt, for joining us here today.
Thank you.
And thank you to our viewers.
Thank you, Captain.
Thank you. Make sure to tune back in we've got so many more conversations with really, really important early childhood figures coming up for you. Tune in at 0to3.org/AC Live. We're going to bring it straight to you. Thank you so much.